But my point is, maybe my story of West Java can give you, I can give the public, the international public, the balance between what they view in general as a country. But if you zoom in, there is so many rewarding and inspiring story to tell also.
Hello and welcome back to On the Level. I'm Jeff Hutton. Today, West Java Governor Ridwan Kamil returns to the pod to say his province has the coronavirus under control. It's a big call, and as far as I can see, he's the first to do so. Neighboring Jakarta has made some big strides, but his province, with a population of 50 million, unearths an average of a couple dozen new cases a day. And I've run through the daily tally of infections at West Java, and they're averaging 27 or so in the past 7 days. Now, we're far from in the clear. Nationally, that is. The number of daily infections seems to climb and then plateau and climb and plateau, and we're at one of those plateaus now, a little under 1,300 a day or so nationally. Places like East Java have seen big surge in cases. The daily average there over the past 7 days was more like 260. So 27 a day in West Java, 263 in East Java. More remote parts of the country are also hard hit. The chief health officer in the Papuan capital, Jayapura, said all of its COVID beds are full. But today on the pod, we're going to celebrate. A not insignificant bit of good news. West Java is the biggest province after all. And we'll be talking to a man a lot of people think will be making a presidential run in 2024. Kamil was mum on that, but he's a man who's having a good crisis, so his performance with COVID won't hurt. Friends, Governor Ridwan Kamil. But Governor, thank you so much for joining me. How goes the battle?
Yes, I think every day is really a dynamic day. My routine is checking the number of new cases, and the last 7 days is up and down, but still very low comparatively to other biggest province. Yeah, sometimes 15, sometimes 19, sometimes 50, 40, but more or less never reach beyond 50, if I'm not mistaken. Our reproductive rate also already below 1 for the last 6 weeks. Sometimes 0.6, sometimes 0.9, 0.8. But according to WHO standard, if you can keep your RT below 1 for the last 14 days, then you can claim that your COVID situation is under control.
Is that fair to say, Governor, that the virus is under control?
Yeah, more or less. So we check also to the hospital, only now down to 27% beds in hospital used for COVID patients. So it's a good news for doctors and nurses. And active case is less than 50% now in West Java, because majority already recovered, And according to WHO also, our positivity rate is the lowest in the whole Java. From 100% PCR testing, West Java always is around 6.6%, while other province from 100% PCR testing, some have 30%, some 11, 12%. West Java is 6.6. So we are trying to make it below 5% for the next following weeks. And we already created the rating system, Jeff, for 27 cities with 9 indicators, and the result is 70% is in the level 2. We call it blue zones. It means economy can be open 90%, and 30% left in yellow zone, which is economy can be open only 60%. No more in the red zone, no more in the black zone. So by having this rating, now we started our new normal in economy, starting the first week of June, and we, according to advice by our economists, we start opening the low risk in terms of healthcare, economic activity. We open first industry, offices and agriculture activities. Then after 7 days, we start opening the high-risk economic activity, which is trade, malls, and shops. Yeah, we still not yet open the education, so we wait for a green zone status. Once any cities in West Java get into green zone, then we can open the public school. So currently, in the blue zone, 90% open except education, and 30% in the yellow zones, 60% economy open.
Governor, if I could just jump in there, sir. Time is limited. The blue zone. What percentage of the population lives in these opening up areas in the blue zone, where 90% of the economy will be opening up?
I think the 30% mostly in the urban area. So this is to conclude that COVID mostly happening in the urban area. So the yellow zone still in the Bodebek, Bogor, Depok, Bekasi, and the city of Bandung, with some Karawang, but majority is in the less populated area of West Java. We call it Kabupaten, as you know it, yeah. So if you area name kota or city, COVID is higher. If your area name Kabupaten or region, your COVID is lower. So that's why 70% majority in the region or Kabupaten area.
This amounts to quite a turnaround from the early days of the pandemic. An R naught of below 1 is considered quite successful and well on the way to ending the contagion. What is the recipe for success in your view?
Yes, I think we have several approaches. Number one, we always listen to the expert. That's number one. Yeah. So I have the advisor of epidemiologists who advise me when to lock down, not to lock down. Yeah. But I have an advisor of economists advising me which economy first to be open and which one to be very slow, and so on and so on. Second approach is we are very proactive, Jeff. We do not wait for always from the central government. We buy our own PCR. We open our testing lab. Yeah, we build many things in our initiative. Even the rating system, Jeff, is West Java first, then the central government. And also, Jeff, I would like to tell you one of the biggest pride of our effort. West Java is the only province, because of the size of its high-tech industry, that can produce all the things to fight COVID. Number one, we are surplus now in PPE products, so we can now export to Belgium and African countries. We are surplus in surgical masks in 5 factories in West Java. We are producing our own ventilators from PT DI, PT Pindad. We are producing now 100,000 PCR reagent per week by Bio Farma. And next week, we are producing our rapid test antigen, more sophisticated and more accurate than typical rapid test. So this is the one that we are using to fight COVID, because we are plentiful, we are abundant of these resources. And last point of this successful fight is I converted 627 ambulance into COVID testing vehicle. So we now, every day, we have 627 COVID testing vehicle running around the city, the villages, testing the crowd on the street, after hours, and so on and so on. So I think because the epidemiologist told me, Pak Ridwan, you cannot lower your alert system while you opening economy. You have to do aggressive testing, aggressive tracking. So that's what we are doing, converting 627 ambulance into COVID testing. So I think this is more or less the things that we are doing every day, checking and opening economy while maintaining the alert situation. So I think you cannot view Indonesia too generally, because if you zoom in, every province has a different story. So I think West Java is a good side of that story.
Is it important to you to get that message out that not all of the country has been hit hard, that there are success stories?
Yeah, because for example, I read some article from Australian newspaper labeling Indonesia very, very bad. But from my objective perspective, West Java is not really the same with that narrative story from that media. So that's why this interview also is very important to tell that West Java, 50 million people, the size of South Korea. We have a good statistic, and we are opening economy. And the economist told me, Pak Ridwan, if we are doing successfully combining healthcare management with economy, our economy could be positive 2%, yeah, instead of minus 2%. So I'm aiming by December, hopefully by this methodology, my economy can still post 2% positive while fighting the COVID with our hundreds of these COVID testing facilities.
How much was the growth in West Java last year?
Last year, 5.1%. Worst scenario will be -2 if I don't do nothing. But if I can cleverly manage to open economy while maintaining the high alert and testing, with maximum is 2.3% growth. And to my surprise, Jeff, agriculture is very formidable. It's very, very tough. Manufacturing and services, they're down to more than 4%. Yeah, yep. But agriculture corrected only 0.9%. So you can see agriculture combined with the digital commerce. I'm thinking that will be the future of West Java after COVID. Is go back to agriculture, but with 4.0 approach, because I see so many villages in West Java, they have a triple income increase because the agriculture product was ordered online. Yeah, so I think.
Just specifically, Governor, your staff briefed me that the province has taken delivery of 20 molecular testing machines, the PCR machines.
Yeah.
That with the reagents that you've been able to produce locally, what is daily testing at like now? Your average test, how many are performing?
Yeah, in total we are testing 230,000 people so far, with around 70,000 PCR and 150,000 using what we have as a rapid test. So we are hoping with our new product of our own PCR by Bio Farma company in West Java, I can increase the number of testing now more or less around less than 2,000 to more than 5,000 testing a day. That will be my target. Yeah.
These are homegrown PCR machines?
Yes.
How did you get the IP for that so fast? Is that the result of a joint venture with a foreign pharmaceutical company, or was it on license? I'm just wondering how you managed to develop a PCR machine so fast.
They have two products. Product number one is they're developing vaccine for COVID, but not yet shared to public. They have a joint venture with Chinese company and one European company. Yeah, that's for the vaccine. But for the PCR agent, I don't think they're joint venture. They are very expert in creating reagent PCR before, not for COVID. It's just for other disease. Yeah. So this technology and the capacities, now they stop producing similar testing to other disease and now focusing to COVID. That's the reason why Bio Farma can produce such a number. I think Pak Jokowi proudly announced yesterday to the whole people of Indonesia that his industry now can produce 100,000 PCR reagent per week. But basically, that industry is Bio Farma of Bandung Indonesia, West Java.
If you get ahead of the curve in terms of, as seems increasingly likely, and you have spare capacity for testing, will you open up to take on samples from the rest of the country?
Yeah, I think so. I think my commitment is everybody got affected. We are lucky to have existing high-tech company home in West Java. So once in the next coming weeks, we are fulfilling our 100% needs, I can easily send helps and produce more also to other provinces in Indonesia. And as you can see, for example, we are before we have emergency on the PPE supplies. Now, since the patient in West Java is low, only 29% use the hospital, so the PPE is now abundant. That's why we now selling to other provinces this PPE product, the hazmat suits, and now selling to Belgium exported, and also to some countries in Africa also.
What does your experience in West Java say about the prospects for the rest of the country? Are you optimistic that other localities will be able to be similarly aggressive?
Yeah, that's very tough questions. Because I don't know the local leader management in handling COVID in other provinces, because so different. Yeah, COVID is really a challenge and testing our leadership qualities and leadership style. I can only talk about West Java, but if you see, we are the biggest population next to epicentrum of Jakarta, but we are also blessed with industries that can produce COVID equipment, tools, and everything. So I think it's very specific, Jeff. So, but relying heavily, Jeff, on the help of central government efforts. Yeah. So I think that's why in our situation, West Java is got help from central government, not as big as other provinces. Maybe because we are more independent in handling COVID.
You made a reference with some frustration about some bad coverage. I think in particular, maybe it was an Australian article, but I've also seen some rather dim views taken by the New York Times. What do you think that coverage does for the reputation of Indonesia? Do you think you're being fairly portrayed?
I think we are not fairly treated and fairly viewed by these two, because if I tell my story, which is very objective and hands-on, I think we are totally different with the general perception. Also, one thing you can check is the number of people treated in the hospital is not as big as other country that having a super crisis in COVID. So I think that's also either so many asymptomatic, maybe, yeah, or maybe we are in a good situation also, because I think hospital always the statistic telling you the truth that not really many people now treated in hospital, especially in West Java. I check also the number of dead people in the cemetery to be got burial during the COVID. West Java maintained the same number of people got buried from last year. So I think there is no suspicious of possibly COVID died in the cemetery. But my point is, maybe my story of West Java can give the public, the international public, the balance between what they view in general as a country. But if you zoom in, there is so many rewarding and inspiring story to tell also.
We are very quickly approaching 50,000 cases of the virus. I know that the growth of active cases is slowing, but it is still increasing, and sometimes at an alarming rate in some parts of the country, especially to the east. You told me that you worried that perhaps the true caseload may be 10 times what is already known. Do you stick with that view, or has it
Yeah, I
mitigated
I
somewhat?
believe I believe the real number is multiplied than what now being announced, but I'm not sure about 10 times. Yeah, I have to check the data, but my belief is the number is higher. And also, Jeff, I believe the COVID will stay a very long time from now, so we have to adjust and keep economy open while maintaining fighting COVID. So that's my belief. That's why, yes, every day we have new cases, but yes, every day also economy must move. That's why I keep looking to my statistic to make sure it's not uh, threatening the West Java in terms of COVID case.
You were suggesting that we have to learn to live with this pandemic for some time. So perhaps maybe now's the time to switch gears and ask some questions that are not COVID related.
Yeah.
The fast train to Bandung, will work pick up again?
Yes, I send people and checking. There are many workers now working, building the concrete pile for this tracks high-speed train. But I believe it will be not as expected. So they promise next year, but I don't think so. I think the fastest the high-speed train may be 2022. Hopefully, still within my time as a governor, because I'm ending my governorship by September 2023. So we are hoping high-speed train will finish, even though it is slower because of COVID. So I think after 3 months, Jeff, we are learning the hard way. Now we are carefully opening back the big projects, but with new COVID protocol implemented.
Are Chinese engineers and other workers back?
Yes, but we're not as viral as the Sulawesi Island Chinese workers. Yeah, it's below radar. They are coming, but not creating a big fuss and news in West Java. So, social and politically, West Java is doing okay so far.
When you spoke to me earlier in this interview about a economic model that included agriculture and a digital economy, you labeled it 4.0. It sounded to me
Yes.
like a visionary type of approach as someone who may have ambition for higher office once his own term ends in September 23, just before the campaign begins for the presidency in 2024. Am I on to something here, Governor?
Yes, I think we launched our digital village project last year, not in the mindset of COVID is coming, but we think because we have disparity in economy between urban and rural. So I agree and I believe with 4.0 and technology, I think rural economy can increase with inclusive economy. So we started digital economy. We converted the village center into the digital center. People can bring products, get photograph, and get online to Tokopedia or the Unicorn. We feed the fish now using mobile phone. We find sea fish now using apps of fish finder. Yeah, we have what we call it drip irrigation technology, and we won the award in May, the Smart City Award for Asia Pacific Innovation Award for the digital village in the category of inclusive innovation. So I think post-COVID with the technology, it means even though you are away from urban and dense area, you can still sell your product online, you can still connect to the global economy online. So my message next year to the fresh graduate in West Java universities is please now go back to villages, get your prosperity like in urban area, and get your business going global. That's probably my new proposal for this new economy. Yeah.
Is this all in preparation, though, for a presidential run?
It's funny you asked that one because during COVID, we learned there are some some survey, about 2024, my electability rate doubled from February, from 3.3 to 3.8 to 7.7 now. People appreciate our effort in the form of political gain. Some people try to say thank you to me by creating a song, Jeff. There are 2 songs dedicated to me, so I'm very touched. But some give some appreciation by giving a political point. So for me, that's a bonus. It's not a goal to have an increase of electability, but it's a bonus because we are serious in handling COVID. We are putting priority on people's life, and we are very honest on what's going on COVID. I think people appreciate this approach. Yeah.
Governor, thank you so much.
Thank you, Jeff. See you next time. Yeah.
I will see you hopefully in person.
Yep. Yeah. Stay safe in Jakarta.
Okay. You too.
Because Central Jakarta is the #1 epicentrum in the whole Indonesia.
Well, Bandung is the place to be, man.
I know. Come soon. Yeah.
I will, Governor. Thank you, sir. Bye now. And that's On the Level. Thanks for listening. Thank you to Governor Ridwan Kamil and his office. Our producer is Stephen Handoko. Research by Imam Shofwan. Music by Soundstripe. I'm Jeff Hutton. Bye for now.